Hello and welcome everyone to the third lecture of our PYQ series for Obstetrics and Gynecology, important for Pdcet Obs-Gyne aspirants, and you can join this channel on YouTube for more such videos. So going through some important topics or questions. First one is, which of the following ovarian tumor is most prone to undergo torsion during pregnancy? This question has been asked previously, that which ovarian tumor is most prone to undergo torsion during pregnancy. Options are serous cystadenoma, mucinous cystadenoma, dermoid cyst, or theca lutein cyst. Just give a second to make a guess. The answer is dermoid cyst. So remember this directly. Dermoid cyst is the ovarian tumor which is most prone to undergo torsion during pregnancy. Okay. Next, which surgical procedure has the highest incidence of ureteric injury? Vaginal hysterectomy, abdominal hysterectomy, Wedem's hysterectomy, or anterior colporrhaphy? So the option is Wedem's hysterectomy. Surgical procedure with highest incidence of ureteric injury among these options is Wedem's hysterectomy. Next, probability of achieving pregnancy with one menstrual cycle is called. Options are fecundity, infertility, fecundability, or uterine factor. So probability of achieving pregnancy within one menstrual cycle is known as C, that is fecundability. Okay, so here are a few definitions. What is fecundity? Ability to achieve a live birth with one menstrual cycle. And infertility, failure of a couple of reproductive age to conceive even at least after at least 1 year of regular coitus without contraception. So next is triad of enlarged upper part of uterus, soft lower part of body, and firm cervix during early pregnancy is known as Jacquemer sign, Hagar sign, Osiander sign, or Goodell sign. So answer is B, that is Hagar sign. So remember in this way, what is Hagar sign? Hagar sign is triad of enlarged upper part of uterus, soft lower part of body, and firm cervix. And this can also be the Hagar sign is seen during early pregnancy. Sorry. Other few signs: Jacquemer or Chadwick sign, dusky hue of vestibular and anterior vaginal wall. Osiander sign, increased pulsation felt through lateral fornices. And Goodell sign is softening of cervix. Soft is always good. So Goodell sign is softening of cervix. Now, longest diameter of skull is mentovertical, submentobrygmatic, occipitofrontal, or suboccipitofrontal. So answer is A, that is mentovertical. So longest diameter of skull is mentovertical. Now remember these diameters: submentobrygmatic 9.5 cm, suboccipitobrygmatic 9.5, suboccipitofrontal is 10, occipitofrontal is important 11.5, submentovertical also 11.5, and mentovertical is the longest, that is 14 cm. Which of the following is correct about pelvic hematoma? So question about pelvic hematoma: options: vulva is the most common site, most common artery involved is pudendal artery, both or none. Answer is C, that is both. So these 2 points about pelvic hematoma are important. Vulva is the most common site and most common artery involved is pudendal artery. Now, maximum capacity of Bakri balloon. Question is about Bakri balloon, which is used in postpartum hemorrhage. Bakri balloon is used in postpartum hemorrhage. And what is the maximum capacity in ml? It's 500 ml. So maximum capacity of Bakri balloon, which is used in postpartum hemorrhage, is 500 ml. So Bakri balloon used in postpartum hemorrhage and maximum capacity is 500 ml. In this way, you have to go through these points and questions. Now, another point about hematological changes in pregnancy: parameters which increases and parameters which decreases. So, which parameters increases during pregnancy? Hemoglobin mass, total plasma protein, globulin, fibrinogen, insulin, transferring level, CRP, and ESR. And parameters which decreases: hemoglobin concentration, urea, creat, uric acid, albumin, platelets, blood urea nitrogen, serum iron, and ferritin. So, especially remember for this iron profile, so transferrin levels increases and serum iron and ferritin levels decreases during pregnancy. A female with thalassemia gets pregnant. What dose of folic acid will you prescribe? So answer is D, that is 5 mg daily. Patient is thalassemic and she is getting pregnant, so folic acid 5 mg daily is to be given. Now, dose of folic acid in different conditions: prophylaxis to prevent neural tube defects 400 microgram as per WHO and 500 microgram as per MOHFW. Treatment of folic acid deficiency 800 microgram as per WHO and 1 mg as per MOHFW. If previous child history with NTS, the neural tube defects, 5 mg, and sickle cell disease or thalassemia also 5 mg. Now, which maneuver is used for delivery of extended legs in case of breech? So extended legs of breech, which maneuver is Pinard, Lorset, Sprague, and none of the above. So answer is A, that is Pinard's maneuver. So what is Pinard's maneuver? It's maneuver which is used for delivery of extended legs in case of breech. Now, so offset maneuver, delivery of extended arms in breech. Modified Prague, deliver the after coming head in breech when back of fetus fails to rotate to symphysis. Burns-Marshall maneuver for after coming head in breech. And Maurice-Smellie technique is delivery of after coming head in case of breech. So remember these techniques. Now, points about cesarean section: advantages of transverse incision and advantages of vertical incision. So what are the advantages of transverse incision? Superior cosmetic results, less post-operative pain, less facial wound dehiscence, and low incidence of incisional hernia. And advantages of vertical incision: minimal blood loss, superior access to upper abdomen, wide operating space, and flexibility for wound extension if required. Remember some incidences: postpartum blues 30 to 75% cases, postpartum depression 10 to 15% cases, postpartum psychosis 0.1 to 0.2% cases. So as the intensity in here coming from top to bottom intensity increases, and the ratio, the percentage of incidence decreases. So blues 30 to 75, depression 10 to 15, and psychosis 0.1 to 0.2%. Now, presence of gas shadow in a chamber of heart or aorta in case of IUFD. So in a case of IUFD, if there is presence of gas shadow in chambers of heart and aorta, this is known as Robert's sign. So Robert's sign, what is Robert's sign? It's presence of gas shadow in chamber of heart or aorta in case of IUFD. Spalding sign, overriding of bones of cranial vault and overlapping vesical bones due to shrinkage of brain after death. Dual halo sign, increased pericranial fat, spine hyperflexion is seen, and crowning of ribs is seen. Now, difference between partial mole and complete mole. Important topic. Karyotype of partial mole is 69XXX or 69XXY. Complete mole is 46XX or 46XY. Uterus size is small for 8 in partial mole, large for 8 in complete mole. Diagnosed partial mole is diagnosed as missed abortion. Complete mole is diagnosed as molar gestation. Initial HCG level in partial mole is less than 1 lakh milli-international unit per ml. In complete mole, it's more than 1 lakh. Embryo fetus often present in partial mole, it's absent in complete mole. Which is not an absolute contraindication to uterine artery embolization. GnRH agonists use uterine malignancy, large fibroid or calcified fibroid. So answer is C, that is large fibroid. Large fibroid is not an absolute contraindication. Okay. So which are the absolute contraindications to uterine artery embolization? GnRH agonists use, asymptomatic fibroids, pregnancy, PID, uterine malignancy, and calcified fibroid. So thank you very much for your patience, and we will come with another lecture in a day or two. So please subscribe this channel and share the link with your friends and colleagues preparing for Pdcet or Neet PG. Thank you very much.